Hello everyone, this is Ara Shahrawan. In this slideshow, I'll discuss some recent endodontic research publications that were published in July 2021. Okay, let me start by telling you a story that all of us face on a daily basis. This is a young dentist and he has his own practice. He may have some treatment-related questions whenever he treats a patient. He has a few options for finding answer to his questions. The vast majority of dentists prefer to seek advice from an expert or a colleague. Some of them look for answers in the textbook. Some up-to-date dentists may prefer search the internet for answers, but as you are aware, we live in knowledge explosion era, and this is extremely difficult to find the exact answer to our questions among millions of web pages. Evidence-based medicine is a reliable scientific method that allows clinicians to find answers to clinical questions more easily and comprehensively. In evidence-based medicine, the best research, evidence, patient preferences, and clinical skills are integrated to help clinicians to find answers to their questions. We also have level of evidence to help us understand what the best research evidence is. The type of study is important in this concept, and systematic reviews and randomized controlled trials provide a higher level of evidence to answer clinical questions. In this video, I discuss some recent endodontic publications that have been cited in PubMed search engine. Because there are numerous endodontic publications published each month, I chose a few that I thought were interesting and, in my opinion, clinically important. As a result, the majority of them have a higher level of evidence. I believe that podcasts and video files that summarize recent research are very useful and useful especially for busy clinicians, which is why you are watching this video right now. Okay, I'll start with 3 papers on diagnosis and clinical examinations. The first is a paper entitled Accuracy of Cold Sensibility Testing on Teeth with Full Coverage Restoration, a clinical study. The authors are from the United States of America. The paper published in International Endodontic Journal. This is a very important paper, I think, about cold testing of full-crowned teeth. They discovered that the cold sensibility test by endo eyes is an accurate method with an 83% sensitivity and 88% specificity, although it is less accurate than on teeth without full coverage crown. Please keep in mind that the cotton was placed on the buccal surface of the teeth for 15 seconds by the researcher. The second paper on diagnosis and treatment planning is titled Associations between Pain Severity, Clinical Findings, and Endodontic Disease a cross-sectional study which has been published in the Journal of Endodontics. The researcher obtained a very important finding based on the pain severity, clinical examination, and endodontic disease of 228 participants. They found that a negative response to cold stimulation on the causative tooth and percussion hypersensitivity on the healthy adjacent tooth are two major predictors of higher level of endodontic pain. Very interesting findings by this researcher. The third paper I present here concerns electric pulp testing. Relationship between the difference in electric pulp test values and the diagnostic type of pulpitis, the title says. The authors are Chinese, as well as the paper published in the journal BNC Oral Health. The status of pulpitis and the degree of electric pulp tests were measured in 203 cases. They demonstrated that the difference in electric pulp test values was insufficient to distinguish reversible pulpitis from symptomatic irreversible pulpitis. Okay, here is a paper on local anesthesia. We'd like to know if low-level laser therapy can aid in the anesthesia of mandibular molars. The paper was written by some Turkish authors and published in an international endodontic journal. The title is The Effect of Low-Level Laser Therapy on the Success Rate of Inferior Alveolar Nerve Blocks in Mandibular Molars with Symptomatic Irreversible Pulpitis, a randomized clinical trial. There were 88 patients divided into two groups. The success rate of anesthesia was only 34% in a group that received only inferior alveolar nerve block. However, when low-level laser therapy was used in addition to inferior alveolar nerve block, the success rate increased significantly to 57%. However, it's obvious that it's insufficient for complete pulpal anesthesia. The following paper is about instrumentation using XP Shaper files. It's a randomized controlled trial written by Egyptian authors and published in an international endodontic journal. The title is Effect of XP Endoshaper versus Conventional Rotal files on Post-Operative Pain and Bacterial Reduction in Oval Canals with Necrotic Pulps, a randomized clinical study. The trial was done on 60 single canal mandibular premolars with necrotic pulp. As shown in the graph, the XP Shaper group, this line, had a lower rate of post-operative pain than the conventional rotary system IRAs. However, there was no significant difference in bacterial reduction between the two groups. Okay, in this paper, which was published in the Journal of Endodontics by some Brazilian authors, the effect of foraminal enlargement in rotal canal preparation was compared to only apical patency. The sample consisted of 114 necrotic single-rooted teeth. They discovered that foraminal enlargement, as you can see in upper photographs, causes more post-operative pain and filling extrusion in comparison to apical, apical patency alone. Okay, the third instrumentation paper that I chose was published in Odontology journal by Italian authors. The goal was to determine the effect of shaft length on the torsional resistance of nitty rotary file. The researcher performed standard torsional strength test on 120 twisted rotary files and discovered that the longer the instrument, the greater the torsional resistance of the file. Interesting finding, I think. Okay, this is the final paper on the topic of instrumentation. We are aware that there are numerous methods for activating irrigation during instrumentation. The researcher from Belgium compared ultrasonic activation and area laser activation, and the paper was published in an international endodontic journal. 56 patients with an asymptomatic tooth were participated in this study. As seen in the graph, the red line, which represents laser-activated irrigation, shows a lower level of pain, particularly in the first 6 hours following RCT. However, there was no significant difference between the two groups. The level of pain, however, was low in both groups. The following paper is a systematic review and meta-analysis of the effect of occlusal reduction on post-operative pain. The authors are from Brazil, and the study was published in the Scientific Report Journal. For the qualitative analysis, 12 studies were included and 9 for the quantitative analysis. They demonstrated that occlusal reduction has no effect on post-operative pain levels following endodontic treatment. And this shows that occlusal reduction can't help for post-operative pain. Okay, this paper is an animal study that was published in Dental Traumatology journal. The authors are from Brazil, and they compared active splinting with orthodontic appliances to passive conventional splinting. The outcomes were encouraging. They demonstrated the active splinting protocol, which employed orthodontic appliances to generate a light and controlled force, favored periodontal ligament repair of replanted teeth. Very nice paper. The effect of root canal therapy on inflammatory maxillary sinus change caused by endodontic infections is discussed in this paper. This is a case series involving 14 patients that was published in the Journal of Endodontics by Brazilian authors. As you can see in this case, there is mucositis and osteoperiostitis and possibly partial or complete sinus obstruction as a result of endodontic infection. The good news is proper root canal therapy can be effective in resolving those inflammatory sinus change, and as you can see, the sinus tissues surrounding the apex have returned to normal. Okay, the final paper is on periodicular surgery. The authors from India assessed the effect of using a piezoelectric device on intraoperative hemorrhage and post-operative quality of life in this study. As seen in the photo, 14 patients were divided into two groups, conventional and piezo group. In the conventional group, surgical carbide bars, as you can see in this photograph, and curettes were used, while in the piezo group, the piezoelectric surgical device was used to perform flap reflection, bone cutting, granulation tissue removal, and root end resection. They discovered that piezoelectric surgery improved patient quality of life in the first week after surgery, with lower level of pain and swelling, as well as better bleeding control during surgery. Okay, I hope you enjoyed this presentation. Thank you for watching, and I'm gonna see you in the next video.